Hello everyone, my name is Young from the University of Medicine and Pharmacy at Ho Chi Minh City. Today I am very grateful for the opportunity to present our work on developing an AI-assisted monogram to predict distant metastasis in gastric cancer. About the background, gastric cancer remains a major global health burden, especially in Asia. One of the main challenges is that many patients are diagnosed at an advanced stage, and distant metastasis is often present at the first time of evaluation. However, current tools for early metastasis detection, such as imaging or tumor marker, are either expensive, not widely used, or have limited sensitivity. Uh, Many previous studies have shown that if systematic inflammatory play a key role in gastric cancer progression, and hematological parameters such as neutrophil to lymphocyte ratio (NLR) or platelet to lymphocyte ratio (BLR) reflect this inflammatory prog- um, inflammatory process in the in gastric cancer. So, our aim of this study was to build an interpretable and practical predictive model using routine clinical variable and these inflammatory markers to estimate the risk of distant metastasis at diagnosis. About the method, we conducted a retrospective study of 92 gastric cancer patients at Ho Chi Minh City Oncology Hospital. Among them, 43 patients had distant metastasis and 49 patients did not. To develop a predictive model, we apply a hybrid AI and clinical workflow. Lasso regression was used to select the most informative variable to our dataset. Next, these selected predictors were then incorporated into multivariate logistic regression model to maintain the interpretability and ease of its clinical use. The cohort was split into training sets, accounting for 70% and test sets 30%. We evaluate model performance using the IUC, the ROC curve, the IUC, the calibration curve, and prior score, and also accuracy metrics. Finally, we constructed an individualized monogram for risk estimation. The result here show that in the table one, this is the baseline of patient characteristic and the figure of the optimal cutoff value of NLR and PLR. The laser feature selection results show that there are three key predictors uh, that had the meaning for distant metastasis, which is NLR, PLR, and tumor primary location. Uh, these variables were then used to build a final logistic model in terms of its performance. The model achieved an AUC of 0.82% in 82%, 82% in the training data set, and in the test set, in the validation data set, each achieved the AUC will remain strong at 79.5%. With the accuracy on the test set around 75, sensitivity around 78.9, and the specificity of 66.7%. Uh, the previous score were low on both training dataset and test sets, around 0.16, uh, and the calibration curve show a good agreement between the predictive and the observed risk. Overall, these metrics indicate that the model is both discriminative and well calibrated. Most importantly, the final output is an interpretable monogram that allows clinicians to generate an individualized probability of distant metastasis based on routinely collected data. In summary, we demonstrate that combining AI-based feature selection with a classical logistic regression can produce a simple, interpretable, and clinical actionable tool because NLR, PLR, and local and tumor location are already available in routine practice. This monogram has the potential to support early metastasis screening, especially in the resources limited setting. However, in the future, I will suggest that the future work should include the multi-center validation and incorporate additional variables such as imaging or molecular feature. Uh, to be better, we should conduct a prospective evaluation of how this model might influence treatment planning and follow-up strategy. We sincerely thank you, the Board of Direction and staff at Ho Chi Minh City of Oncology Hospital for their support throughout the study. And thank you very much for your attention. I really looking forward to discuss this work further during the conference with you. Thank you so much.